Good afternoon, everyone. I am Councillor Graham Bridgman. I am the Deputy Leader of West Berkshire Council. I am the Executive Portfolio Holder for Health and Wellbeing, and I am Chairman of this board. I'm looking around the room to see who is here, and I can see that tonight, I know that Councillor Bowick is due, but is likely to be a little late. I can see we have Councillor Doherty, Leader of Council, Councillor Masters and Councillor Macro. Welcome all. In addition, we have some officers. We have Sean Murphy. We have Matt Pearce. We have Martin Dunscombe. And from the CCG, we have Joe Reeves. I see Councillor Bowick's just joined us. Welcome. And we also have Christine Ursa, who's going to be clerking and hosting Zoom for today's meeting. So I'm going to start by asking Christine to run us through our standard reminders.
Do I need help?
How are you doing, Christine?
So in addition to the points shown on screen, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Any voting will be done via a show of physical hands. If we need to adjourn the meeting for, is it not? Oh,
it's
sorry.
Showing on my screen, Christine,
Okay.
So you're okay, you crack on.
Okay.
So short adjournment.
If we need to adjourn the meeting for any reason, then you will be advised of the revised time and date of the meeting. If it is a short adjournment, you will be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent out. Do members have any questions about the way in which the meeting will be run?
I think we do. So, Christine, could we start with apologies for absence?
It's delayed.
Shall I tell you what I know, Christine, and we'll see where we go to from there. I know that Meriden Peachy has sent her apologies. I know that Andy Sharp has sent his apologies. I know Councillor Macro is substituting for Councillor Martha Vickers. I can see you've got a problem with your headphones. I shall carry on. This is good fun, isn't it? I'm trying to think. I'm sure I've seen one other, but we'll come back to that. I thought there was another apology. No. Okay. Members, we'll move on through the minutes of the previous meeting. You've been sent the pack with the minutes of the previous meeting. Does anyone have any amendments they wish to propose to the minutes? I see no one itching to do so. I will propose them from the chair. Does that find a seconder? Thank you, leader. And members, all those in favour of agreeing the minutes, hand in front of the screen, please. All agreed. Excellent. Thank you. Yes, Joe, you too. Okay, moving on then. The first item, sorry, before we move on to items on the agenda, I should formally check that there are no declarations of interest. Does anyone have any formal declarations they need to make? No, fine. So we will move on to the first substantive item on the agenda, which is our COVID-19 situation report. And I think, Matt, you are going to deal with that. Over to you.
Thanks, Chair. So just going to take you through a few slides just reflecting on the latest position with regards to COVID-19. So the summary slide, which we always show, is this slide here, which just gives an overview of the testing rate, the positivity rate, the cases per 100,000 of all ages and 60 plus. So obviously just bear in mind that the latest data has just come out from Department of Health and Social Care. So this is from yesterday, so it's not the most updated version. So as you can see, the testing rate across all local authorities and regional and national average has come down slightly, apart from Bracknell Forest. West Berkshire is highlighted green for information. The positivity rate in West Berkshire is 6.4, which is lower than the regional and national average. The only one that's actually higher is Bracknell Forest, which is 8.7, which is higher than the regional average. In terms of the cases per 100,000, so in West Berkshire, this currently stands at 215.2 per 100,000. And again, all local authorities are below the regional and national average, apart from Bracknell Forest. So regional average is 291, and the national average is 398. In terms of cases per 100,000 for 60 plus, so the age group obviously that's been adversely impacted the most throughout the pandemic, this is starting to rise now. It's creeping up to around 50 per 100,000. And from this data, it's around 341 cases per the last 7 days. The most recent data we have is our rate is now around 250 per 100,000 for all ages. And our rate per 60,000 is around 50 per 100,000. So we've seen quite a significant rise over the last week or two, and I'll go onto that in a minute. Nationally, the R rate is estimated to be between around 1.2 and 1.5. In South East, it's around 1.2 to 1. I think 1.2 to 1.6 in South East. The epidemic curves for the Berkshire LAs, again, this just reflects really that we all, apart from Bracknell Forest, below the regional average, apologies, but we're all kind of following that same trend, and we're clearly now on that third wave. So in terms of what that increase looks like, it's a 58% increase on the week before, but actually it's quite a significant jump, 257% increase in our rates on all ages compared to that when we last sat 2 weeks ago. So you can really see that, and there's been a total of 7,788 cases in West Berkshire since the pandemic started. And you can just see a little bit more closely on this epi curve how you can just see the number of cases have shot up quite substantially over the last couple of weeks or two. Sorry. In terms of the rates by age category, so again, this is always just helpful for us to see, and it will reflect probably when Joe comes on to talk about vaccinations in terms of what age cohorts we're seeing the majority of cases affect. As you can see, the darker blue towards purple and black almost represents higher rates per 100,000 in those specific cohorts. So you can clearly see from this heat map, 15 to 19, 20 to 24, 25 to 29, that's really where we're seeing the large majority of the cases. However, what we have started to see over the last few weeks or two is the darker shades moving up the age ranges, and that's completely expected. As we see higher incidence, it will reach up those age ranges as people go out and about and socialise. And it's also reflected, particularly today, just through my knowledge, and I'm sure Sean will be able to corroborate that, we are seeing a lot of cases in schools as we head towards the end of the summer term, both across primary and secondary schools. So in terms of rates by wards, this is just looking at the 2 weekly period. The left-hand side just looks at the 2 weekly rate per 100,000 of the last 2 weeks, and then to the right-hand side, it looks at the total cases and rates per 100,000. There's a few outliers. Obviously, the numbers on the left-hand side are crude numbers, and what we do is we standardise these to the rate per 100,000, so we can actually compare to different wards, which is why we convert them to rates. So we have seen over the last couple of weeks some particular outbreaks in Hungerford, Burfield and Mortimer, Newbury-Greenham, and Tilehurst. Again, when you look at the rates, there's still a bit of an outlier in terms of Tilehurst and Birch Copse, Thiel, Hungerford and Kintbury, and Aldermaston. And again, just the map, which you will be familiar with, the darker shades just reflecting those rates really, and they're reflecting anything from 300 to 400 per 100,000. Those are the real dark blue areas, and again, you're seeing it's quite an even spread across the district, although there are a few areas where the rates are slightly lower. So in terms of the deaths, again, it's still relatively positive. There's been 255 related deaths, COVID-related deaths since the start of the pandemic, but there have been no deaths reported in the last 2 weeks. And again, this graph just really shows that we're kind of mirroring the 5-year average for the number of excess deaths that we'd see at this time of the year. So as things stand, clearly the vaccination is having a real positive impact on deaths. In terms of hospital activity, which I know a lot of us are interested in, I think there is starting to be a slight uptick in hospital admissions. So as things stand, there were 18 new COVID-19 admissions between the 5th and the 11th of July. And on the 13th of July, the most recent data we had, there were 6 confirmed COVID-19 patients in hospital, with 1 on mechanical ventilation. We are starting to get to see the data now in terms of the vaccination status of those individuals, and there is some evidence that individuals with 2 doses are getting COVID, but that was always to be expected. As I said previously, no vaccine is 100% effective, so we will likely see a rise over the coming weeks and months ahead. This data it just shows the cases and hospital admissions by end of the week. So it just shows the number of cases in green and the hospital admissions in black. So again, you can see in that second wave how the number of hospital admissions mirrored that of cases. But as we approach that third wave, you can slightly see an upturn in those hospital admissions, but not as substantial as what it was previously, and lagging behind the number of cases. So I just wanted to cover a little bit about some context. I think that is really important. So I think, clearly we are seeing that cases are increasing rapidly, and we know from the SAGE minutes that came out a couple of weeks ago, this is likely going to continue until the end of August. And clearly we are on the third wave. I think as we move to step forward, we have done from today, I think it's really important to say that this isn't over. And there does need to be a need for caution and restraint. I think one of the reasons the government have progressed this line in terms of releasing restrictions is that it is the end of the school term. This is taking place over the summer, where more people socialise outside and there's less NHS pressures. And it's probably the least bad option in terms of when we could potentially release restrictions. What we do know, though, is actually the peak of the resurgence will be slower if the return to pre-pandemic behaviours is gradual. So you're hearing lots of instructions from the government about just taking our time, releasing the restrictions slowly, people taking personal responsibility and understanding the risks as they come out of the pandemic into more of a normality. What we do know, though, is there's 4 major risks associated with the high number of infections. So we still need to maintain and reduce the number of infections as we can. They are going up, but there are a whole host of risks. That could be long COVID, which we've talked about before, both in children and adults. You would have heard in the news around business continuity, the need for people to self-isolate, whether that's with symptoms or as contacts, and new variants and hospitalizations and deaths. So we think that hospitalizations and death will be lower than wave 2, but there's still lots of uncertainty around some of that modelling. And lots of that uncertainty is down to how we behave as individuals, how we take that personal and collective responsibility, but also how the vaccine actually behaves and works and how effective it is. There's still lots of uncertainty around that. The other thing we need to be wary of is the combination of high prevalence and high levels of vaccination creates conditions in which an immune escape variant is most likely to emerge. So again, we really need to try and suppress transmission as much as we can. But it also presents a challenge to testing, contact tracing and sequencing. So Sean will know demand on our contact tracing service is going up. Sometimes that prevents how we actually engage with people because of capacity. Same with testing and also sequencing. If testing is under control, then sometimes that puts pressure on labs to sequence the data in terms of identifying any new variants. So the key message is really is that, fundamental, people still need to test when they have symptoms. One of the biggest ways of preventing transmission is if you have symptoms, you need to go and get a test and isolate alongside vaccination and getting that vaccination when offered. And you must isolate if you test positive, or if you're contacted by NHS Test and Trace, or whether you're advised to by the app. I guess going forward, I think the key message coming out is that the government is no longer, whilst they're no longer instructing people to work from home, they do expect a gradual return over the summer. Face coverings is clearly a contentious one. The recommendations are to wear them in crowded areas such as public transport and enclosed areas where ventilation is really poor. But there are things we can do. Think about being outside more, letting fresh air in, wearing a face covering if you're meeting with people you don't regularly meet up with, and then just trying to minimise the number, proximity and duration of social contacts, and regularly test yourself using lateral flow testing, which I'll just cover in a second, and obviously clean and wash your hands and sanitize. I think it's really important to refer to these as protective measures. These aren't restrictions, these are interventions, and I don't think we want to conflate the two. So there are still things we can do as interventions to reduce transmission, whilst not necessarily restricting the things that we do as individuals. Finally, if it's okay, Chair, I just wanted to quickly cover lateral flow testing, only just a couple of slides really, because I said that's one of our key interventions we can do to support, and people often ask lots of questions. There are two types of testing that people can do. This infographic just explains it quite nicely. So we have a rapid COVID-19 test. So this is normally referred to as lateral flow testing or asymptomatic testing. So these are for people with no COVID symptoms. And then there are the PCR tests, and these are for people that have COVID symptoms. With the rapid COVID test, this isn't sent to wait for processing, so we can't identify if a variant's present. But what it can do is give you the result within 30 minutes and tell you if you have COVID-19. And if you have a lateral flow test, you'd normally get a confirmatory PCR test. With PCR, that is sent away for processing. And again, we can determine whether there's a variant present within that sample, and you normally get your results within 72 hours. And again, that can tell you whether you have COVID-19. So in West Berkshire, that we have home testing kits. So these are available from majority of the pharmacies across West Berkshire. You can also order them online and via that link. So you can just go into gov.uk. And we also have home testing kits available from Thatcher Memorial Hall until the end of August, Hungerford and Newbury pop-up sites. And we also have a mobile van route. Again, further information is available on the council websites about where that mobile van goes. And then finally, we also have assisted testing. So this is really important for those that maybe feel a bit uncomfortable about not knowing how to test. We know that the accuracy of testing improves if people are trained and told how to do the test. So if you've still never done a lateral flow test before, it's worthwhile going to one of these sites to learn how to do it and give you the tools and knowledge to be able to do that. So again, Thatcher Memorial Hall do this alongside Hungerford and Newbury pop-up sites, and then the mobile van also going around the district. So I'll stop there and happy to take some questions.
Thanks, Matt. I'll start if I may, and then see who else wants to come in. Just a comment that I went to one of our major do-it-yourself retailers this afternoon, and most people wearing masks and socially distancing, so that was positive. I thought that was good, and I wasn't necessarily expecting that to be the case, but it certainly was. Okay. You said that there hadn't been any deaths in the last 2 weeks on one of your slides, and the blue line showing deaths due to COVID, but I couldn't actually see anything. I was going back to March looking for a blue line. So have we actually had any deaths since March?
Yeah, no, we've had a few deaths. So the last one was
maybe it's just a very thin blue line.
It's a very small blue line. Yeah, it's very small.
And I certainly confirm from my own experience that there are outbreaks in schools. We've got 2 schools in my ward that have have outbreaks and are remote schooling as a result in all or in part. And therefore, I was quite surprised that the heat map was showing what I put, given that we've had very green or light green heat maps at the top end of the scale for the somewhat older members of our district, seeing that had got quite dark blue for quite a lot of those areas. Is there any thought process on what's going on? Because I fully understand why children and young people might be affected, but everybody?
The number of cases across all the ages. Yeah, I mean, when we look at our coincidence reports, is we are seeing obviously more people are going back to work now. So I'd imagine the working age is, again, people are socialising, and I guess that's some communication we need to do on the Sean's team, is how we encourage those businesses to return more gradually, and obviously maintain some of those protective measures. So I think it is just literally people are mixing more now, and as we will see as from today, there is that risk that transmission goes up higher, and I think we expect that, as I say, up until probably the mid of August.
Okay, and then finally from me, you spoke about reduced hospitalisation, principally because of people having been vaccinated, and Absolutely. The numbers I looked at, I think this morning from Royal Berks certainly go along with that. I guess my question is to what extent we can correlate hospitalizations with vaccination, because I understand fully that people who've been vaccinated may still get COVID, and some of those people may still get hospitalized. But my perception is that hospitalizations, if we look at we've talked about the efficacy of both Pfizer and AstraZeneca against hospitalization before, that we would anticipate that hospitalizations would be among the younger age group who aren't necessarily single or double vaccinated. And do you have any numbers on that or any thoughts on that?
No, we don't have any local numbers. We are collecting that information, but that's not publicly available. But I think we're still seeing those people that haven't been vaccinated going into hospital or had one dose. We are seeing some with 2 doses, but it's few and far between. So it just emphasises that importance of getting your vaccination. It really is the most important thing people can do in terms of protecting themselves going forward.
Thank you. Councillor Doherty.
Sorry, I was actually trying to take my hand down there because Councillor Bridgman, you've actually beat me to the very question that I was going to ask, which was about the number of people, and you mentioned sort of 18 individuals and 6 individuals, Matt, and I was just wondering if we had any data on them to know if they had been vaccinated, if they've been vaccinated once or twice. So you beat me to it, Councillor Bridgman, and I was trying to take my hand down there. Apologies.
Councillor Masters.
Thank you, Chairman. Thank you, Matt. I think you covered most of what was concerning me in terms of the numbers. So thank you for that. The lateral flow testing. There's been a few notes on social media about the possibility of running out soon. I mean, is stock holding up in West Berkshire? Do we have adequate lateral flow testing kits to meet current demand or increased demand?
I've not heard anything to that, to be honest. So as far as I'm aware, we have sufficient supply. I think one of the key things is actually encouraging people to collect the lateral flow testing device. I think it is difficult because people obviously feel well. If they don't feel there's anything wrong with them, why would I actually go out of my way to take a test? So I think the key thing is that let's encourage as many people to get these lateral flow devices as they can. Think about where they might be going, or actually taking a lateral flow device test might be really helpful if they're going to events, spending time with family and friends. It's still one of the many things we can do, and it's not just one thing that will help us through this pandemic. It's all the things we've talked about, isn't it? The vaccinations, being sensible, wearing face covering. But yes, in direct your answer to your question, I've not heard of any problems in West Berkshire.
Okay, thank you. Additionally, the trajectory is obviously quite high at the moment. With the modelling that you're seeing, and maybe you can or can't comment directly, how high would it be before we start doing surge testing and taking remedial measures at local level, and what contingencies are there in place? I don't know if you can answer that, or Sean might be able to answer that.
Yeah, I mean, the modelling is really, really difficult. I mean, to be honest, I think people really don't know because there's so many factors and variables at play here. And as I said, how people comply behaviourally, how effective the vaccine is. I mean, even if, there's if I don't know, let's just for example, the first dose wasn't 96%, it was 90%, that can have a big difference in terms of cases and hospitalisation. So I think national modelling, I mean, that's all available in the SAGE minutes. We can have a look at that. They're talking something about 1,000 hospital admissions a day. It could be more, up to 3,000 to 4,000. And I guess it's then how does the NHS cope with that? In terms of surge testing, that tends to happen if there's a new variant or a significant outbreak. The government are due to publish a new COVID contain framework to guide how we kind of need to review our local outbreak management plans. So we're waiting for that to be published in the next couple of weeks. And I guess that would include things like enhanced areas of support, so where areas can draw down on national resources to help them combat that. At this moment in time, there's no discussion underway because we're lower than the regional and national average, but we always keep that under review.
Okay, thank you very much, Matt. Cheers. Thank you, Chairman.
Let me say welcome to Nick Carter, who's joined us, and Councillor Doherty.
Thanks, Councillor Bridgman. Councillor Masters just reminded me something. Matt, with regards to the lateral flow tests and the use of things like events and that, I know that many events are now starting to talk about COVID passports or showing proof of lateral flow tests. How does somebody do that, and how easy is it? Because there's also lots of discussions going on around things like the football season starting back up and whether season tickets holders will be able to go along. I'm thinking about Reading. Whether season ticket holders will be able to go along if they haven't been double vaccinated, and what proof do they show of a lateral flow test? Are you able to give any sort of clarity on those sorts of elements at this point? I was also talking to a bunch of students who told me that because they go to university in Wales, will their vaccine be recognised by NHS England, stuff like that? And I'm not seeing very much communication on these types of issues. I just wonder, is there a communication plan on it? What information can we share with people on this? Because it's the sort of questions that are coming up from residents.
Well, before Matt comes in, let me say that I looked at the NHS vaccine passport app this afternoon. So I've got some personal, basically, so far as I was concerned, what I did was use my NHS. You've got to be registered with the NHS app. So once you're registered with the NHS app, that should know whether or not, because your doctor's records should reflect the fact that you've been vaccinated or not vaccinated. And the passport lasts about 3 days. So if I had triggered a passport today, it would last until the 21st of July. That's the sort of time scale for the passport. Now, how that flows into people who have a natural immunity and people who have been tested, I don't know. All I can talk about is how it affects people who've been double vaccinated, like me. Matt.
Yeah, no, I think you've answered quite a lot. Thanks. And I think that's a lot of that detail still being worked through, and what I think a lot of the onus is on venues, I think, to decide what kind of measures they want in place. I don't understand there's actually any legal obligation for some of these events to do these things. So I guess there's probably a conversation. I know Sean's just put his hand up. He might want to comment in terms of, as we work with events in terms of their risk assessments, we might want to have a conversation with them about all the mitigating strategies they can put in place. But we clearly need to align with what the government are saying. But obviously, at the same time, put everything in place we can do to reduce transmission. I'll defer to Sean, Chair, if that's okay. You might have something to add.
You carry on.
Thanks, Matt. I was just going to add actually that obviously the range of guidance came in on Friday, which I was going to touch on later on when I talk to the board. But it does encourage businesses to look at this issue, both of local tracing data, for example, still encouraging them to display the QR code and everything else, even though it's not compulsory, but also encouraging businesses, certain types of businesses, to consider the whole issue of the NHS COVID pass, as they call it in the guidance. So this is something that we are looking at in terms of the advice that we give to businesses. Obviously, it doesn't apply to anybody under 18, but there is quite a kind of emphasis, certainly in all of the guidance, where you get groups of people gathering.
Yeah, I think there is a longer question. I think Councillor Doherty touched on it about cross-border. Certainly not necessarily cross-border within the UK, but certainly cross-border from Europe, for example, where someone's been double vaccinated in Italy or Spain and is a British citizen and needs to somehow prove it to the NHS over here. So I think there's a bit of movement to go on that front. So members, I see no further hands, so we shall move on to the vaccination update. And I think that's Joe, isn't it, Joe?
Thank you. I will share my screen and begin, as I have done the past few meetings, with showing the latest data on the government coronavirus dashboard. So it was updated at 4 o'clock today, and is showing that we now have 116,601 first doses administered to West Berkshire residents and just under 90,000 second doses. We are working on a population estimate that there are just over 122,000 adults in West Berkshire. So we've got about 5,000 adults that have not yet received a vaccination. Just looking in terms of the latest activity, the last 2 days worth of data is incomplete, so there may be some change, but just to show 361 vaccinations on the 16th, which was Friday, And of course, not entirely a clear picture yet, but we are seeing most of our activity over the weekends. And just a quick comparison with second doses, there were higher levels of activity, second doses over the weekend just gone. What I would like to show you is a little bit of the increase in take-up among the younger age groups. So I last presented to this board on the 5th of July. So back then we were looking at just shy of 60% of 18 to 24s, and likewise about 67% of the 25 to 29s. Looking now a fortnight later, we're looking at 71.5% of 18 to 24s having received their first vaccination. So I think that's a pretty good increase in just a fortnight. So going over to my slides, just checking you can still see my slides. I'll go through the more granular reports, which I usually present, with the usual caveat that because most of this data is collected from the GP systems to which we have access, we're not covering all of the West Berkshire population, but it does allow us, as mentioned, to get more of the granular detail.
So, Joe, can I just stop you there? The 122.8 thousand, that is excluding the PCN, the practices that don't subscribe to that particular NHS software, or is that including them?
So under captured in this report is the practice populations to which we have access, minus the 3 surgeries.
Right, so the 122 does or doesn't include those 3 surgeries?
It does include them because that's West Berkshire residents.
Right, so you wouldn't expect to get up to 122?
No.
Yeah. Even if you've got 100%, you'd still not make it to 122 because you've got 3 surgeries excluded.
Yeah.
Thank you.
So this slide just provides a high-level summary of overall take-up. So just to highlight, there will be slight variations in the percentages given due to sort of dates the reports was run compared to the latest data on the government dashboard, which I just showed you. But this report run on Friday is showing us with 86.1% of West Berkshire residents aged over 18 having received at least 1 vaccination, which benchmarks pretty well to England and better than our system partners in Buckinghamshire, Oxfordshire and Berkshire West. A new slide has been added to this slide deck using data from Foundry, which is one of the systems used to manage the vaccination programme. And the reason that this total again differs, so we're now looking at 127,000 population, is because it includes patients of practices within the West Berkshire area who may not be West Berkshire residents. So unfortunately, we're not always comparing apples with apples, but I think this just helps give an idea of take up by practice grouping. So for those not in the know, the A34 primary care network covers the Downham practice, Strawberry Hill and Eastfield House. So straight down the A34, if you were looking down, looking at a map. The Kennet PCN includes Falkland Surgery in South Newbury, Thatcham Medical Centre and Birdwood Surgery in Thatcham. West Berkshire Rural is Lambourne, Hungerford and Kintbury. So that's quite helpful really, given that 2 of the practices for which we don't receive data are in that area. So it's quite good to see the take up there. And West Reading Villages includes Chapel Row, Mortimer, Beal and Pangbourne. So looking at overall take-up changes by age group, the largest percentage point increase has been among the 18 to 19-year-olds, with smaller levels of increase in the age groups going upwards. 68% of people in West Berkshire aged 18 to 29 have received at least 1 vaccination now, and that's up 47% from 2 weeks ago and is on a par with our partners in Wokingham and exceeds the take-up in that age group in Reading. Looking at the take-up by those age groups and ethnicity, The Asian and British Asian groups have had the highest percentage take up so far, which is quite pleasing to see, given a lot of the discussions we've had around particular ethnic groups and take up in the past. And of course, hoping that these all turn green over the next couple of weeks as more and more young people come forward to get their vaccination. And just to pick up on one of Matt's points earlier about the age groups where we are seeing more positive COVID tests, it's just worth highlighting that if there is anybody who has missed out on a chance to get their vaccination because they might have been self-isolating, that this is an evergreen offer. So when you're not self-isolating anymore, either pop on the website or look at local social media, print media, or within your local communities to find out when and where the nearest vaccination clinic is, and please do come forward. This slide again shows take up by particular at-risk groups with previously we reported a slightly lower take up of second doses among people with serious mental illness, but that now exceeds 80% across all age bands, which is really good to see. And growth in take up continues to be largely among second doses. And finally, looking at a couple of the more deprived wards in West Berkshire, we are seeing that the gap in take up among people in their 20s between these two areas remains relatively large, which we've discussed many times before about potentially just taking a little bit longer to catch up, but as ever, keeping a watching brief over it and making sure that we provide ample opportunities, and we also engage with communities in these wards to encourage the highest levels of take-up that we can. So that brings me to the end of my slides. I just wanted to make a couple of other points, but does anyone have any questions on the slides before I take them down?
No, crack on, Jo.
Brilliant. So what else did I want to raise? Yeah, just to highlight, I am aware that there was an announcement regarding vaccinations for children with certain conditions or meeting certain parameters aged between 12 and 18, but we're yet to receive guidance on how that part of the vaccination programme will be deployed. So not able to speak any further to that at this moment in time. And also some guidance came out on the 14th, I think, regarding early planning for COVID boosters for particular groups of the adult population at risk, alongside flu. So in the coming weeks, I should be able to report back further on what that's going to look like locally. And I think that's me.
Yeah, I'll just add one thing, if I may, before I bring Councillor Macro in, which is just to reflect that for anyone from the public who's watching, we are aware that we had a cancellation of the vaccination bus at Thatcham a week ago. I've had an apology from the CCG regarding that. It was a combination of circumstances and couldn't be avoided, but they are putting systems in place so that what happened then, if it happened again, would be covered. So I think that's positive, and I'm thank Health on the people behind Health on the Move for coming back to us on that and for saying that to us. But that issue seems to be sorted. Councillor Macro.
Thank you. It's really about information and publicity about where to go for vaccination and how to do it. Somebody posed a question on one of my local Facebook pages, I think it was, basically saying they couldn't make an appointment at the Badesi Centre in Reading, and where could they go? And I got some data down from the NHS website. I had a complete list of all the places you could go to get a vaccination, and they said that the Badesi Centre was closing on the 23rd, and another centre in the centre of Reading was opening a week later. But, really, I think there should be somewhere where people can go and find out all this kind of thing. You shouldn't be kind of having to search around. And even then, it's not clear if you go to, say, a pharmacy, whether you need to make an appointment. Whether you go to Boots in Newbury, Boots in Reading, but do you need an appointment to do that, or do you just turn up? There seems to be a lack of information now. In the early days, people were getting appointments from the doctors and so on, or they go on the website. But now there's a lot more places people can go, but there's not much information about how to get there and what to do.
Joe, I'll leave that to you.
So since the vaccination programme started, largely it began with GP practices directly inviting patients either by letter or text, and then towards younger age groups transitioned to largely booking through the national booking website or via 119. So anybody who booked an appointment at a site such as the Majeski will be able to go back onto that website and amend their appointment if no longer suitable. And if, for example, with it will be the same team running that vaccination centre, but instead of Majeski, they're going to be in Broad Street Mall in Reading. So anybody with an appointment booked will be contacted directly if they're not aware of the new location, or they'd be contacted directly to rearrange their appointment. But I take your point absolutely that with more of these sort of micro pop-up clinics, it's quite difficult to keep track of what's going on where. So my advice would be for anybody looking to book their vaccination is to use the website, the national booking website primarily. The target of these smaller pop-up clinics are quite specific communities where either our community engagement teams or our data is showing that we've got a bit less of a take-up and a need to particularly go into that community to try and capture a few more people. But yeah, my first port of call would be to go on the national website, or as you say, the CCG has a web page which is listing where that Health on the Move programme is popping up over the next couple of weeks.
So is the CCG website available now?
Yes.
Yeah. And would that include things like Boots in Broad Street in Reading or Northbrook Street in Newbury, for example?
No, because those would all be on the national booking system.
Are they? Right, okay. Because the trouble is you can't find out what's on the national booking system without starting off on the booking process, which it's a bit, a bit lengthy and puts a pressure on the system. It's not needed.
Well, I take your point. But when you go on the national booking system, it will show you where there are available appointments and when, rather than just an entire list of all sites, because that seems like the most practical thing for a person kind of trying to amend or book an appointment, rather than showing them all the places that they could have gone to but are unable to book at that time.
Right. Okay, thanks.
I'll remind you both that you're going to have to learn to call it the Select Car Leasing Stadium. There you go.
No. It's taken all this time to develop Medeski.
Right. Okay. Right. We move on. Yes, we move on, members, to Public Protection Partnership. Sean, you have some slides today.
I do, Chair.
How exciting.
I've got 2 or 3 slides, if I may. Just bear with me. Okay. We okay with that? Yeah, so I just really want to talk about 2 things. One of them is the issue of outbreaks, but firstly, the issue of a bit of an update on where we are with the business stuff and the issues that we touched on earlier on. So, as you're aware, basically, most of the regulations that related to business fell away at midnight, were revoked by regulations that came out last week. There was one exception to that, actually, which I think is relevant to us, because it's not that there are no controls, in the sense that we have the regulations which we have talked about at this board before, which we call the number 3 regulations, which are those regulations that give the local authority powers to give directions in relation to premises, gatherings and events, public spaces. So they are still in place. And in fact, those regulations have been extended until towards the end of September now. So if we did have premises of particular concern or events of particular concern, we still do have some powers to deal with those. But the rest of the regulations have gone. They were replaced, they weren't replaced, regulations weren't replaced, but a range of new guidance was issued at the end of last week. And we attended a HSE Health and Safety Executive briefing about that guidance. But it does cover basically the expectations in step 4, and it's broken down by kind of sector. So it includes things like construction and outdoor work, events, attractions, hotels and guest accommodation, offices, hospitality, takeaways, and things like shops, close contact services. And I have to say, actually, having looked through some of this guidance, basically, I think it's extremely helpful for businesses. It does set out the kind of things that they need to be thinking about when they carry out their risk assessments, which they're required to do under the Health and Safety at Work Act. And that really is the kind of starting point in the discussions that we've had with businesses. Obviously, we've got businesses coming to us for asking for advice about approach and things like that. But what we're saying to them is that you need to take your own risk assessments, obviously, which they've done, to take account of the new guidance that's been issued. And there's a lot of really helpful stuff in there, as I say, which particularly strong emphasis on things like cleaning and ventilation is one of the key ones. Managing basically staff, managing outbreaks, and still encouraging, as I said earlier on, basically the collection of data by the businesses to support contact tracing, and also talks a little bit in some of the guidance around things like the COVID pass, as we've discussed. The other emphasis that we're actually making to businesses is that actually business continuity is a critical factor for them. So in fact, actually, put aside their legal obligations under the Health and Safety at Work Act, there is an imperative on businesses to keep their staff safe, to keep the business running. Because obviously there's if you've got all your staff off self-isolating or a significant number, then clearly basically that's going to impact on the ability of the business to actually to run. And finally, the other point we've made is that there is an issue around customer perception and expectation. And I think, Chair, you touched on this today earlier on in the meeting when you talked about your experience at the DIY store. I think that's obviously where a lot of people are. It's obviously not where everyone necessarily is. But actually, basically, I think customers by and large are expecting to see some degree of measures in place that basically provide them with reassurance that the business is taking the steps to protect them. So I think we have stressed this point that those three things, the customer perception, the business continuity, and the legal requirements around risk assessments is critical going forward for them, especially during this period, but also to stress for the fact that it all needs to be basically managed in a kind of very kind of dynamic way, with the situation changing, basically rates changing, and obviously things like vaccination profiles changing, vaccination profiles of staff and the general population. So just moving very quickly to events, we still have around about 50 looking ahead still to take place in the district that we're aware of, basically over the coming months. We are still getting a large number of event management plans, risk assessments coming through to the service, but actually very reassuringly, they are coming through with COVID risk assessments with them still, even obviously basically, even though a lot of the legislative framework around that, apart from health and safety, has been removed. The significant thing is that the numbers restriction that was in the regulations has gone. So as you're aware that apart from the trial events, they were limited to 4,000 attendees outside and 2,000 indoors. That restriction is now gone and will be left basically to normal risk management arrangements. And finally, from a public protection focus, we are focusing our visits now. So as you're aware, we were carrying out a lot of visits basically to businesses, but we are shifting our focus now to those businesses where we've had requests for support and advice from them, where we've got case-related intelligence, so information basically of common exposure points, revisits where we've had issues previously, and where we've had issues raised by residents. It's not to say we won't be carrying out any other visits, but that's our primary focus in relation to compliance work going forward. And obviously the other areas, we are attending a significant number of the events, the bigger events or the ones across the district. So just moving very quickly on to outbreaks and tracing, as Matt has already said, most risk setting notified cases we're getting at the moment are in schools and early years. I mean, there was a lot of those last week, and just looking very quickly at the information that's coming through to the notifications today, it's primarily pretty well all schools and early years again today, which ties in with the figures that Matt gave earlier. We have a small number of workplace cases, clusters, so things like retail settings and things like that, that we're looking at. And we do a lot of work on those when they come in to basically look at, for two reasons. One of them is to have a look at basically how they could have occurred, whether there's any kind of lessons to be learned or whether there's any wider implications. As I say, we look at common exposures. So this is looking at data around premises and where people have mentioned those premises when they've gone through the tracing process, track and trace process, and we start to look for basically patterns there around those kind of common exposures and whether any work needs to be done on that. Just a couple of other areas quickly. In terms of isolation calls, these are obviously up significantly. You would expect that in line with the number of in line with the number of cases locally. But those figures there just give you a bit of idea of what that looks like. So in May we had 470. These are phone calls rather than, don't include emails as well. 672 in June, and so far in July here we are. We're at 19th, 1,200 already. So that's a big increase in workload for the in fact at the moment basically one officer that deals with that. So we're trying to get some more support in as a matter of urgency on all of that. And then just moving on finally, a final slide on contact tracing. This gives you a bit of an indication as to where we are. So Matt was saying contact tracing rates were going up. As you can see, this only takes us back to the beginning of June. We were getting 0 to 5 cases a day up until kind of mid-June. And you can see basically what's happened the last 7 days, basically. So again, we are looking at how we resource that going forward, because this is obviously a 7-day service, and just trying to get some short-term support in to help that. So that's the end of my kind of brief update, Chair. I'm happy to take any questions.
I look around the room to see if there are any, and I see no hands. So thank you, Sean. We will move on to Martin and comms. Martin.
Lovely. Good evening, everyone. I'll keep it brief. I'm conscious of time. Hopefully you can see the slides. I've only got 2 slides to share with you this evening. First is just to update you on the work we've been doing since we last presented to the board.
At the moment, we're still seeing a black screen. I don't know about anybody else. I've just got.
Are you? Okay. Apologies. Let me see if I can sort that out.
We got you.
Well, that's something, isn't it? But right. Okay. Sorry. Apologies. Let me try one more time. Right. Can you see that now?
Yeah.
Perfect. All right. Thank you. So the main priority for us over the past couple of weeks has been supporting the national messaging around the move to Step 4. It's been widely covered in the media, but really sort of sharing that, amplifying the message locally, and particularly where there's locally relevant messaging to share. We've also as a council, been considering the impact of our own services and making sure we're in a position to give our own service users, whether it's at Shore House or the libraries or elsewhere, the right advice and guidance. This is doing some apologies. This is doing something very strange. As you know, it's been all about moving to personal responsibility and away from legislative requirements, and all about making good choices and the onus back onto residents themselves. So for residents, that'll be around face coverings, fresh air, good hygiene, and for businesses, as Sean was saying, good ventilation, making sure staff are properly trained and have regular cleaning in place, and so on. And then in terms of looking forward, we've got four key strands really to our communications as we move on to personal responsibility, which is around encouraging people to self-isolate and explaining the importance of that if indeed they do get pinged. Promoting sensible precautions. That comes back to making the right choices again around face masks, distancing, and so on. Getting the jab and also getting tested if you think you might be developing symptoms. And so coming up specifically, some activities we've got planned or are planned and will support. We're expecting later in the week a new national campaign to be launched around supporting personal choices. So that's very much going to be the next phase on from hands, face, space and outdoors. We've got some new video content we're going to be sharing, including around the importance of getting a second jab. We're doing some work with local leaders. So we started with the leader today, talking about the importance of not easing up too much as we move through to step 4. And the shared Berkshire Public Health team will be sharing some TikTok videos that we can share as well. Encouraging compliance with the rules very much comes back down to sort of personal choice again. Long COVID is something we want to continue sort of raising awareness of as a way to encourage people to get their second or indeed first vaccinations. We are looking for case studies of people locally that have had long COVID, and I'd be delighted if anyone at the meeting today or watching and who knew case studies or was willing to be a case study, if they were able to work with us, that would be fantastic. And then, of course, the most important two messages locally, vaccinations, continuing to encourage people to take their jabs, and also re-emphasising the importance of getting community testing, doing community testing. So apologies for that concludes my update today on that.
Thank you, Martin. Members, any questions for comms? No, so let us move on to the question of future, not just future agenda items, but question of future meetings. We penciled last time. We were, as you recall, members, we are sort of penciling two meetings ahead every time. So we're deciding whether to meet next time and penciling in another one for the 2 weeks after that, so that we've got it in the diary. So we penciled in the 2nd of August last time. My personal feeling is we should meet. I don't think we're out of the woods by any means yet. I think the numbers are showing that, and I think we need to see how step 4 has impacted and what the approach of our district is in terms of compliance with regulations that no longer apply but might be a good idea in the public health space, if I can put it like that. Does anyone have any disagreement with that? So if no one does, what we'll do is we'll say we will meet again in a fortnight's time and pencil in a fortnight beyond that. And again, next time have that discussion as to whether we then meet on the, what's it going to be, the 16th of August. So Christine, that's the 2nd for a meeting. As usual, I will invite you to email me if you think you've got any agenda items that we don't cover as standard. And I now look for any hands to indicate there is any AOB. I see none, so I will. Sean, you got in there. Just
sorry,
right.
I was just going to say that obviously the other thing I forgot to mention, obviously we've had the announcement tonight, haven't we, that they are looking at this issue of COVID passports for crowded venues. At the moment, they are talking about things like nightclubs, but there isn't a definition so far of what a crowded venue is. So that's another aspect to that. I forgot to mention, actually, I was just going to mention that in my presentation.
Yeah, that did sort of come up earlier, didn't it? So, I mean, if between you and Matt could do a little bit of digging to see what's going on out there in government land, it would be interesting to find out what we can find out before we come back together again. Yeah. So thank you for that. Okay. Any other AOB? I see none, so I will call this meeting to a close, ask members to stay in the room until it's been confirmed that streaming has concluded, and I leave that to Christine.